Hi, I'm Dr. David Smotrich, founder and medical director of La Jolla IVF, and it's my pleasure to talk to you about fertility preservation. At La Jolla IVF, we have the ability to freeze sperm for gentlemen, freeze eggs for women, and freeze embryos as well. Freezing sperm is not a technology that is new. It's been around for about 30 to 40 years. We've had actual patients in our practice that had frozen sperm from 30 years ago be successfully thawed, fertilize egg, and have healthy babies with us. Egg freezing is something that we've been doing in our practice since before 2000. Egg freezing has technologically advanced to such a rate that it is virtually the same as fresh eggs now. We use a technology called the Stanford vitrification protocol, where we're able to freeze mature eggs very rapidly and be able to have them, in theory, to be frozen indefinitely until you find your partner or you want to create embryos. Most of the time we recommend that people use their frozen eggs within the first 5 years, but we still have patients that have eggs frozen here since 2000. Embryos have been frozen in our community now since back in the 1981 and 82. Since then, thousands of babies have been born worldwide using embryo freezing technology, and we use vitrification also for our embryos to be frozen, the same technology that we use with freezing eggs. In theory, again, embryos can be frozen indefinitely, but we recommend using frozen embryos within the first 5 years. These three technologies, sperm freezing, egg freezing, and embryo freezing, have enabled patients the opportunity to freeze their tissues prior to chemotherapy, prior to surgery, or when they're at a younger age, and then come back as much as 5 or 10 years later to have higher pregnancy rates when they're of a greater age. Because we know that tissues, especially eggs and embryos, can be negatively impacted as a woman gets older. So if you're considering preserving your fertility for the future, it'd be our pleasure to see you here at La Jolla IVF to discuss the different options that you have. I look forward to seeing you here in our practice.